Vitamin E is a fat-soluble nutrient that acts as an antioxidant in the body. It helps to protect cells from damage caused by harmful molecules called free radicals. It is also important for the proper function of the immune system and for the maintenance of healthy skin and eyes. There are 8 different forms of vitamin E, with alpha-tocopherol being the most commonly found and studied in human nutrition. Good dietary sources of vitamin E include nuts and seeds, vegetable oils, leafy green vegetables, and fortified cereals. While vitamin E deficiency is rare, it can occur in individuals with certain medical conditions that interfere with the absorption of dietary fats, such as cystic fibrosis and liver disease. The recommended daily amount of vitamin E for adults is 15 milligrams a day. However, taking high doses of vitamin E supplements may increase the risk of bleeding, especially in individuals taking blood-thinning medications or with a history of bleeding disorders. It is always important to speak with a healthcare provider before starting any new supplement regimen. Vitamin E deficiency is rare, but when it does occur, it can cause a range of symptoms. The symptoms of vitamin E deficiency may include 1. Muscle weakness. Vitamin E plays a role in maintaining healthy muscle function. A deficiency in vitamin E can lead to muscle weakness, particularly in the arms and legs. 2. Vision problems. Vitamin E is important for maintaining healthy eyes. A deficiency in vitamin E can cause vision problems, including difficulty seeing in low light or reduced vision. 3. Skin problems. Vitamin E is important for maintaining healthy skin. A deficiency in vitamin E can cause dry, rough skin or small bumps on the skin. 4. Impaired immune function. Vitamin E plays a role in supporting the immune system. A deficiency in vitamin E can impair immune function, leading to an increased risk of infections. 5. Nerve problems. Vitamin E is important for maintaining healthy nerve function. A deficiency in vitamin E can cause nerve damage, leading to symptoms such as numbness, tingling, or loss of sensation in the hands and feet. It is important to note that these symptoms can also be caused by other medical conditions, so it is important to speak with a healthcare provider if you are experiencing any of these symptoms.